So this is how to administer parenteral nutrition through a central line. So first you're going to be checking the order and verifying that this patient is going to be getting this treatment. You're going to gather your supplies, go to the patient's room, perform hand hygiene, acknowledge the patient, explain to them what is going to be happening, the procedure, and why, and then you're going to identify the patient using the two identifying factors, name and date of birth. You're going to perform hand hygiene. For this procedure, you're going to use strict aseptic technique, and you're going to also make sure that you are replacing this set every 24 hours, or if it's contaminated, you change everything immediately. So we're going to go ahead and verify the feeding with the MAR, and you're going to check the feeding and the expiration date. You're going to make sure that everything is matching for the patient. The patient's name is on the bag, and you have all that information there. You're going to check the compatibility. You're going to make sure you label the patient's name on the bag if it's not on there already. You're going to perform hand hygiene, apply the clean gloves, set up your IV administration set, connect to the CPN aseptically. You're going to attach the filter to the IV tubing if you have one, prime the tubing with the CPN, and make sure you close it after, making sure there's no air bubbles. Scrub the hub for, we say at least 30 seconds, but it says 5 to 60 seconds depending on the policy of the facility that you're at. Scrub with alcohol wipe, or whatever the policy of the procedure or of the facility you're at. And then you're going to connect the tubing to the port. You're going to confirm the rate, which you would have already done prior because you looked at the MAR and the order, so you should already know it. So confirm the rate again. You're going to label the bag and the tubing with the date, time, and initial, so that they can be changed in the 24 hours, and then put the IV tubing into the pump. Make sure that you have the pump first before you go into the room. That's part of gathering the supplies. You're going to set the infusion rate, and then you're going to open the clamp, start the machine, and stay with the patient for a few moments, making sure that the patient's responding well, they're not having any reactions. You would also have already verified the allergic reactions prior to all of this when you're looking at the MAR, and then you're going to make sure that the infusion's running, there's no issues, it's not leaking, and then when you're done with all of that, the patient should be tolerating well. So just clean up, make sure that the patient's dispose of everything, the proper receptacles. Make sure the patient's side rails are up appropriately. Call light is within reach but is in low position. The patient is tolerating it well, and you're going to go ahead and document. So document everything from what you gave the patient, what's the rate, what time you gave it, how long it's supposed to be going, the patient's reaction, if there was a reaction, how the patient is tolerating it, and that is about it.